Hey, everybody. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I am joined by my friend and colleague, Lisa, who is not only passionate about clinical excellence, but also transforming the patient experience. Lisa, it's an honor to have you on today.
Yeah, thanks so much, Kelly. It's good to be here with all you guys, getting to chat about dentistry and the things that motivate me.
Yeah, and that sometimes is what we look forward to, right? When we think about our weeks, it's what's good's going to happen if everything else is falling apart. This episode is sponsored by vVardis, and we're talking about Curodont repair from vVardis. And trust me, you're going to want to hear about how this fits into your practice. So, Lisa, let's start from the beginning. Why dentistry for you? Did it choose you?
Oh,
Did you choose it?
I was a very young human being when I fell into dentistry. So, you definitely have more immature moments when you're younger of things that
Mm,
just somehow shape your life. I was putting myself through college. I liked sciences. I liked things that were challenging to me, which most of college was, being somebody who has dyslexia and a learning disability.
wow.
And I really liked to put myself in environments where I was uncomfortable and where I knew things didn't come easy because I knew that was the way to get to like next levels in life.
Mhm.
And just happened to be dating somebody who was into dentistry. That's the immature portion of the story. But it did open my eyes to the field. And then once I
Mhm.
started doing some observations and digging more into it and the ability to work with people and to possibly make a difference in somebody else's life, almost a pay it forward environment, that's really what appealed to me. The financial part of it was also a little bit of an appeal back
Yeah.
then as well. So, it just checked all the boxes. And then I thought if I didn't like it, I'll just switch to something else. And 25 years later, I am still here, Kelly.
You're here for it. And a lot of things have changed throughout the years. Just even in 5 years, right?
Oh, a lot. The way I practiced dental hygiene 25 years ago, and fast forward, I've just recently come out of higher education. So I was training the next generation dental
Mm,
hygienist and dental assistant professional. And the things I was teaching my students didn't exist when I went to school. It was not the way I was taught how to do dentistry. And it really wasn't until I got into higher ed where I was like, oh my goodness, I have learned all these things on the job force. I had to learn how to do all of these variety of technologies and the way I approach patient care and outcomes of patients is completely different 10 years ago than it was 25 years ago. And that's why they call dental professionals lifelong learners.
yeah.
It doesn't stop when you get out of school because
Mm.
technology keeps progressing forward, which is a little bit of the story of how I got into working with vVardis and insisting that they hire me.
Oh, I love this. I love this for you. So you oh, yeah. So wait, you went from clinical hygienist
Mhm.
to faculty member. Tell us about that, and then tell us about the next jump, and how did you know I have lots of questions. So tell us about, like, what in your mind was like, "I need to do this." What was the pull for you?
Yeah, I opened Pandora's box with that, didn't I? So, yes, yes, I really just enjoyed clinical hygiene. I still do clinical hygiene. It's a couple days a month with the travel schedule that I have, but I never left clinical practice. And after about 12 years doing clinical practice, I really got to a point where I felt like I was hitting that glass ceiling from a clinician standpoint where I really just didn't have more to learn. I'd kind of tapped out of constantly keeping up with the progression of dental hygiene and always incorporating new styles, new technology into practice. And then I thought, what better way to utilize this decade of skills I've acquired, but to pay it forward to the next generation? Let me go ahead and figure out how I can get into higher education. And I was fortunate enough to have gone to dental hygiene school and received a bachelor's from Baylor College of Dentistry. So that was an option for me. And that's how I started in higher ed. And I like to say I started from the very bottom and worked my way up from a part-time adjunct instructor to a full-time instructor to a professorship to a program director. The next step for me would have been vice provost or dean, and which actually, Kelly, the plan. I really had no intentions of leaving higher education when I did it this past December. I thought that that would just retire me over the next, 10, 15 years of my life until I found out about guided enamel remineralization and Curodont Repair Fluoride Plus, which is the product, like you were saying, that vVardis manufacturers. So I had started publishing a little bit on this procedure in the product. I wrote a couple of continuing education courses, did a couple of webinars. I've been a CE speaker and author for 20 years. And I was fortunate enough to work in practices that were early adopters of new technology. Of course, that's my
Yeah.
draw.
Mhm.
And I got to perform guided enamel remineralization for almost 18 months before I literally called vVardis myself. I had a contact out there and I said, you need to hire me. I want to bring my talents to your organization. I don't care about the money. I don't care about anything else. I want to work with you guys because as I dedicated almost 15 years of my life to training the next dental professional, that next level and paying that forward, I now felt like I could pay it forward from a public health standpoint.
Mhm.
And we can
Mhm.
change the face of dental caries statistics in this country with this product. So it's just another opportunity for me to influence the masses and give a benefit to the dental field.
Yeah, it's that aha, isn't it?
Yes.
Your story sounds so familiar to me because it's so much like mine, where I was in higher education and I thought, okay, what's next? I could do this. And then so I was like, okay, we could talk about that another time for sure. But it's what drew you. It was that aha where it's like microbiology class where you can't unsee things, and it because it starts to change your approach to how you care for that patient. So when, you know, I know that we're going to talk all um, about Curodont today, but tell me when you think about early caries, because that is what Curodont Repair treats. How has your approach changed with the newer option with this non-invasive treatment?
I love everything you just said. I love the fact that, and I'm going to steal your quote, once you see it, you can't unsee it. So what's interesting to me is if you really think about the United States approach in dentistry, the types of treatments we have, the types of preventive agents that we've been using my entire career, plus people who've been doing this longer than me, right? We have never really been trained to spend any amount of time diagnosing, identifying, and charting exactly these early initial incipient carious lesions. We know they're there. We tend to put a watch on it, but we don't get into the nitty gritty of like, let me see how many I can find. Oh, I bet there's demineralization on this tooth, and maybe there's a start of it here. And,
True.
we've never been trained to get into the nitty gritty of that, like actually diagnosing the E1 versus E2 lesions with the ADA caries classification system. And we may see demineralization, but we're not going to chart every dim we see everywhere. Why? We
Yeah.
didn't have any interventions to do anything about it. Doc's not going to drill and fill it until it's grown large enough to cross the DEJ and get into the dentin.
Right.
We don't have any additional medicaments to recommend than what we already have as regards to fluoride or maybe calcium phosphate products. So it really just wasn't important for us to write down every single tooth and every single surface we see this in. We just make a note that there's localized or generalized
Yes.
demineralization and we move on, right?
Yes.
So
Yes.
incorporating guided enamel remineralization into the practices I've been in has really made us like stop, slow our roll, reevaluate, and go, we actually do need to identify
Mhm.
every single area of demon, no matter how small into the enamel or how deep into the enamel it goes, because now we finally have a medicament that can be used to treat these lesions, to
Yep.
actually heal them from the inside out. And so that's been a big paradigm shift for me in the practices that I work in, is not necessarily that our exams take any longer, but once I see it, I can't unsee it. And
Mm.
now I know how to look for it. Now I know how to identify it. And we've actually brought in a lot of practices I'm in, because I temp a lot, we've brought in a lot of like new technologies into the dental practice, specifically centered around finding these initial carious lesions so we can proactively treat them with Curodont Repair Fluoride Plus.
What was your aha moment when you realized that this could be a game changer for you?
Oh my gosh. Can I tell you the story? It's a story.
There's
Can
always
I
an
share?
aha moment. This is yeah,
Okay.
please, please,
So
please.
honestly, I'm going to try not to cry with this aha moment, because there's not an audience that I speak to that doesn't get this pull at your heartstrings story. So my son is 16 years old. His name is Braden. And Braden has had at least 1 to 2 cavities a year since the age of 4. And his mama does what I do, right? So he's got every electric toothbrush, he's got every water pick, probiotic, paste this, paste that, prescription stuff, over the counter stuff. He's got everything that he could possibly need to not get cavities. His sister's a year younger and never had a cavity. So don't tell me dental caries does not have a genetic link, because I absolutely know it does with my kid. He got mama's teeth, is what I tell him. And so, this has been a battle Braden's entire life. And it's been a battle for me to make it where he doesn't hate the dentist, because every time he goes, he gets
Mm,
shots, he gets drilled, he feels
yeah.
bad about himself, because he keeps getting these cavities. He knows how
Yeah.
much I value teeth, and he values it as well. And so he just kind of feels like he got the short end of the stick. So, I bring him into the dentist every 4 to 6 months. He gets x-rays because he's severe high caries risk. And when he was 16 years old, and this just happened 18 months ago, Dr. Wynn is our family dentist, and he comes and grabs me out of the waiting room and he says, "Hey, I need you to come back and look at Braden's x-rays, and I need you not to cry." And I was like, OMG, what now? There's got to be something going
I
on, because
want
there's
you to
always
not
something.
cry. Yeah,
Yes. And I was like, oh gosh, what
I'm
is
gonna
it?
need you to keep it together.
And I'm thinking endo, right? Like that's just where my brain goes, or maybe he cracked a tooth or something. No, I walk in, and every single maxillary permanent tooth at age 16 has a significant dental caries in it. Some of the dental
No.
caries have completely penetrated the DEJ. Some of the dental caries are sitting right on it, but every single maxillary anterior tooth, the most cosmesis zone of any patient's smile, has pretty significant decay that occurs, I mean, honestly, in 6 months. Like he just progresses that fast, right? That's just his story, and that's how he is. And a lot of you guys listening, you have patients like this, where their lesions, the very smallest problem that you see 6 months later, turns into like almost endo,
That's
right?
right. That's
Braden
right.
almost needed a gingivectomy on the mesial 7. That's how deep his decay went. So luckily he didn't. But to kind of get to the point of Curodont, Dr. Wynn had just purchased his first box of it. And he said, "Hey, have you ever applied this product?" And I was like, "No, but I actually wrote a CE course on this and I know a lot about it. And I'm so excited you have it, because I was going to ask you about it." And he goes, "Well," he's like, "you got a couple lesions here. Like I've never done it before, but surely it can't be that difficult to apply. Let's put this on and see what happens." The research supports it. There's systematic reviews, over 230 publications, RCTs on it. Like very confident that this product's going to work on a lot of Braden's lesions. So we ended up doing not just the maxillary anteriors, but we actually treated 11 lesions
Wow.
with Curodont Repair Fluoride Plus. And unfortunately, some of those maxillary anteriors, there was no amount of, medicament or Curodont that was going to help those. So they did need fillings. But, what's really hard for me is I know by the time Braden is my age and he's in his 40s, that lateral incisor is going to be a crown. And I hope it doesn't turn into endo one day, right? Because fillings don't last a lifetime. And he's such a young patient to be having that amount of invasive dentistry done in cosmesis areas. So that's why Dr. Wynn said, "Don't cry, mom." But I'll tell you what, actually, I did cry that day. It happened. Okay. But fast forward a year, I cried again. And let me tell you why. Because a year later, every lesion that we treated with Curodont Repair Fluoride Plus on him, none of them needed fillings. And this is on a kid that almost needed a gingivectomy. His cavity was so
Wow.
deep that
Yeah.
occurs in a 6-month period. And that's what makes me want to cry. And that was the day when I got that 1 year post-op. I'd actually been doing some like key opinion leader guest speaking for Curodont and for vVardis, just because I really wanted to spread the word of this product to
Mhm.
providers and tell them what I see on my patients and my son. But I actually called them and I said, you need to create a position for me. I want to come in on something on clinical education. This is my experience level. When you're ready, call me. And so I really just kind of hounded them and went and found my own job with a company that I knew I could come in and
Wow.
really, really back and support what they're doing. And so that's my aha
Crazy.
moment. And here's the thing, I treat every single patient like they're Braden. I
Yeah.
find every single DMIN, incipient, early, initial, whatever y'all are calling it, carious lesion. I find every single one I can. And I tell that patient or I tell that parent or whoever the situation is, what's going on, what can happen, and now what we can do about it. Because Kelly, for the first time in my life, in my son's life, I'm sorry, not my life, in his life, I could turn to him and say, Braden, for the first time in your life, mommy can fix this. I can actually fix your cavities so that you don't need more fillings. And it
I
tears me
got
up every
chills.
time I say that, because there's one thing to be a dental professional, it's another thing for that to be my kid.
That's
So
right.
I treat every patient like they're Braden, and I tell every parent the types of invasive dentistry that we can avoid to avoid your kid feeling all the ways I know my son feels and
Right.
has felt his whole life. So that is the reason why I do what I do. Everything I do has an intention. It's got a meaning. It's got something to it behind just, oh, that sounds like a cool company to work for. And so if that story doesn't plug at every heartstring of every dental professional listening, I don't
Mhm.
know what will.
Yeah, there's well, we talked two things. We talked about that it's non-invasive, so there's no drilling. I've been using Curodont Repair Plus for over 3 years, and I've seen
Mm.
amazing. Those areas that we typically would watch, and I know you all do, and I know we do. Watch that do what? So these are those watch areas. So it's non-invasive, there's no drilling, but then to your point, the emotional impact it has about how this changes when we think about a lifespan of a person like a pediatric patient and how it shapes their trust in dentistry from that very beginning and then to when it transfers into even our older patients and maybe those dealing with dry mouth because many of them do or a lifetime of dental work. That's the emotional shift. There's an emotional shift that tell them they don't need another filling, right? So it's a lifetime of less trauma, more trust, and better outcomes. And it's it's not just clinical. There's an emotional, psychological aspect to this, like you just mentioned.
I love that you said that. And if you really think about the medicaments we've had on the market prior to this, and when you talk about cavitated lesions or nearly cavitated lesions, really, if you were going to try to perform a non invasive procedure, you were relying on things like silverdimine. And I know I used them on Braden on his primary teeth when he was younger, but the disadvantage of it is it causes that permanent staining, right? So when you think about that like emotional connection there, I'm not going to put silverdimine on maxillary anterior permanent teeth, right? So I'm going to have to put that kid through a drill and fill procedure because I don't have any other choice. There's no other non-invasive medicaments that can actually go in there and remineralize these lesions, either completely have them disappear like they were never there,
Right.
or at least cause a rest so that we don't need to perform invasive procedures. So the beauty of Cure Not Repair Fluoride Plus is it's non-staining. I actually have no idea where I placed this medicament on any of the hundreds of lesions I've used it on in the
Same.
last 2 years of my life, other
Right.
than to chart it. That's the only way I know it. And so I tell patients all the time that what this medicament does that's different than others is it puts back what Mother Nature took away.
Mm,
I can actually take away this cavity that you have forming, this hole you have in your tooth that's still in the enamel. I can make it like that never happened.
yeah.
And you get a second chance at preventing yourself from getting dental caries. And here's the big thing too, it's a one-time application. Silver diamine, I'm constantly putting it on over and over and over again. I'm constantly looking at the
Mm,
areas that I did and do I need to do it again? And how do I know I need to do it again? And has it progressed? Has it not? Like, it's so hard to make these judgment calls as providers
right.
because we're looking at two-dimensional pictures of three-dimensional objects with our
Mhm.
dental x-rays.
Yeah,
AA technology has been a wonderful addition
yeah,
into the practices I work in. And that was what I was telling you. Some of the practices I've been in have actually purchased advanced technology specifically to understand and find these areas that are candidates for guided enamel remineralization with cure not repair fluoride
yeah,
plus. Because if we can't find it, we can't treat it. And
right.
AI has been one of those big game changers where
Right.
that computer can read 500 shades of gray where I can only see about 40 to 60 shades of gray.
Mm,
So it can find these lesions that I can treat for patients before they march their way up to invasive dental procedures.
yeah, because there's if we're thinking about how time is compressed within a practice, about doctor comes in, we're looking, we put up things that we may think that are there. Doctor may come in and find something and go, "Oh, did you see this?" And it gives you that sort of that second opinion on things, and it calls it out
Mm.
and helps us explain and communicate the why behind early treatment, I think, too, because we use this in our practice as well, because I still practice clinically.
Ah.
Yeah, and so it pops it right on there. We're able to see where it is, or it's calling out those areas. So, Lisa, how are you explaining the treatment to patients when they can't see or feel anything wrong yet?
Oh my goodness. This is the easiest product I have ever introduced into my clinical practice over my 25 years that has been the easiest conversation with patients. I mean, I've gone through a generation where I graduated school and dental hygienists weren't using lasers. So I've had to use them on the workforce and explain to patients why I want to use it for the variety of procedures I want to. It
Mhm.
usually requires a lot of conversation, a lot of Q&A, and it really does eat into my time.
Yeah,
Curadont does not. Honestly, 3 sentences are typically all I need to explain this to a patient. The notion of they don't know they have a problem because they can't feel it doesn't tend to be a problem in the practices I'm in. And I'll tell you why, because I have advantages that maybe some of you listening do not have. I've got artificial intelligence. So I've got an x-ray that pops up, and everywhere where their lesions aren't completely progressed through the dentin, it appears one color.
mhm,
Areas where it is progressed through the dentin appear another. The patients can actually see the different colors.
yeah,
And I can just say, hey, look at all these orange areas, look at all these red areas, right? So that's easy. I also have the advantage of having scanners that have near infrared imaging. So I actually have early caries detection systems in the
yes,
interproximal lesions with NERI and with infrared. I've worked in offices that have fluorescence technology. So
yeah,
they can, again, find these early lesions. So really, for me, that conversation doesn't really exist because the picture or the scan is worth a million words. So they immediately see it. So that's number one, right? They
mhm,
immediately see it. And I tell them, you guys, we need to use the actual words of what we're talking about. Saying you have a little bit of cavity, you have a little demineralization, you have an area where the enamel's starting to soften. You have a hole in your tooth. The hole, hopefully, is still in the enamel. And I'm just going to say a little happy thought in my head that when doctor comes in to look at this lesion, what I'm hoping is that he or she says that that hole is still in the enamel. Because if it is, lucky you. We now have a procedure called guided enamel
yeah,
remineralization where we can apply a medicine into that lesion and we can completely get rid of it and reverse it with an over 90% success rate.
yes,
And I say, but if you're not that lucky and it has progressed through the second layer of the tooth, sorry, you're getting a drill, you're getting a shot, you're getting a filling, which I know you hate, but you don't have a choice. So let's hope that all these lesions are candidates for guided enamel remineralization, and we're actually able to put back what Mother Nature's taking away from you.
Mhm.
And normally the first question isn't anything like crazy. It's normally, wait a minute, why haven't you done this before?
Mhm.
You did a filling on me 6 months ago or last year, the
Yep.
last time I was in. Why couldn't you offer this then? Right? So it's more like it's almost accusatory, like, "Oh, how come y'all just are now doing this?" So I explained to them, "Hey, this has only been a procedure available in the United States for the last couple years. We've now been trained on this, and moving forward, this is how we'll be treating." And I'll tell you what, okay, here's something interesting I've seen is I like to think I'm a great hygienist and I'm a good patient motivator, but we're only so wonderful, right? I have actually seen my patients coming back at the recall that I'm recommending, whether it's 3, 4, or 6 month recalls, when they traditionally have not been compliant with it, not to get their teeth cleaned, not because I've scared them and convinced them that they have gum disease or they're going to get gum disease, but it's for Curidon. So they're
Really?
coming back and saying, "Well, oh yeah, I'm going to come back for my recall because if I have any more of these little holes in my teeth, I want them treated with Curidon." And I'm
Yeah.
like, "Okay, so all the things I've been trained to do, you don't care about. But the good news is I don't care what motivates them. Whatever gets them back
Back.
is going to allow me to handle the gum disease. And if that's the fear of cavities and drills and fills and all that, then fine. I'll use that fear factor all day long to get these people healthy periodontal structures."
Yeah. It's, what I say to my patients is, "I'm so glad that we caught this at the stage it is because
Yes,
we can
similar.
actually heal it. We can heal this. We can help your body heal this." And they're like,
Lucky
"What do
you.
you mean? What do you mean?" And so Lisa, tell me about when you're using the product, does it add time? Because we know that time is always a big thing where hygienists and docs
Hmm.
are going,
Oh yeah.
I don't have a lot of it. So tell me about your workflow. I can talk about mine too, but I don't find that there's so much, I say dead time. There's so much time like that we're doing chart notes, waiting on doctor, cleaning up the tray. We're always doing something to use and fill that time. So for me, it's pretty straightforward. It does not add any time into my procedure. Maybe 1 minute. Maybe 1 minute. How about you?
Yeah. So, in offices I work in that have been doing guided enamel remineralization, what I will say is not that we've changed our workflow, we've changed our mindset. We
Mm.
we recognize everybody's role in the office, and what we want to do is maximize those roles, and we want to efficiently use those roles. So here's just a very few small kind of mental changes and prep changes we've made that make it so we can do what you're doing, where we can perform guided enamel remineralization same day, usually after a cleaning, because to apply the medicament, you do want to clean to surface. And there it is. I cleaned it and I did a really good job at it. So let's apply it today. So we found a way to put this into our procedures without costing us more time, without
Mhm.
running behind schedule or just adding one more thing. And so here's the
Right.
very small changes we made that make very large differences. Number one, every practice I work at, we do chart audits. And I would assume most of you listening do the same thing. So I usually audit the night before, or I come in early and I audit the morning of. So, number one, I go through every single record and do my normal checklist: who needs
Yep.
bite wings, who needs fluoride, whose insurance pays for it, who had watches on their teeth last time,
Yep.
I pull up the x rays, take a quick look. Do we see any incipient interproximal lesions last time? Yeah, we saw 6. So I bring that to the morning huddle. So not only am I going through my normal hygiene, blah, 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 but I say, "Doctor, I've got 9 patients on my schedule today. 3 of them you put watches on in the last year. So just get ready, front desk. We're probably going to have some guided enamel remineralization today." So that's step number one. The smallest little things like that get everybody in the right mindset.
Yes.
Step number two is all about me, the hygienist. So, one of the things that we have done in a lot of my practices is anytime I have a patient and I've done my assessment intake, I know by looking at an x ray and doing a visual cursory look at teeth, I know when I have lesions that are candidates for guided enamel remineralization. Every hygienist on the planet does. We're trained to look for dental caries. We're trained to look for demineralization. We're also trained to perform a Cambra. So I know when I've got a moderate to high caries patient risk
Mhm.
with these areas of demen. So what I do is I page doctor earlier. And I usually send either if I have a Bluetooth note or I've got a paging system or I communicate with the assistant, it doesn't matter. Whatever your theory is behind and how you guys work through things, I'm going to page doctor earlier and I right next to it, I put GER. And so it lets doctor know, like, and I do the same thing for sealants. I know when I want to do same day sealants, I do the
Yeah.
same thing to
Yep.
doc. I put sealants next to it or I put GER next to it because it lets doctor know, okay, I got 3 hygienists, I got 3 exams. Let me do Lisa's first because she is probably going to add same day treatment on. So I'm going to get in there quick.
Yep.
So it lets doctor know, plants that seed that just come to me first. Speed that up just a little bit. If you get a little break, pop in. I've already done the education. Just come in and say, yeah, what Lisa said. Get out of my room. So
Bye.
the next,
No
yeah,
talk.
bye.
No talk. No
I'll
talking.
handle this. Yes, yes, I got this. And so then by the end of the procedure, I already know that I need to be more efficient with what I'm doing. Leave myself a couple of extra minutes, just like I would if I was going to do any same day treatment. So I try to multitask throughout the procedure, leave that extra couple of minutes at the end, because to your testament, it takes less than 5 minutes to do
Yeah.
this procedure, less than 3 if I already cleaned the teeth.
That's
And
right.
so, you really are able to add this into the end of the procedure. And I'll tell you what, the procedure itself is quick and easy, but I've even found ways to speed up that procedure. So once you get the medicament on the tooth, one of the things you need to do is just have like a basic isolation time where you
Mhm.
just got the cotton rolls in there. The tooth's not bone dry, but you just kind of need to let it set for a little bit. And so when you do that, I'm usually doing other things. I'm doing my notes. I'm messaging the front desk and I'm saying, hey, I'm going to be a patient up. I get the goodie bag together. So I'm really not adding time in my day. And because a lot of the practices that I work in, we don't have necessarily insurance coverage on this procedure just yet. Just another pearl I can put in y'all's brain alongside all the other things I recommended is when the front desk at the morning huddle hears Lisa say, hey, I have potential 3 GERs today. After I get doctor in there to diagnose the procedure, I immediately shoot a message up to the front desk. Hey, put in 6 GERs. Will you please bring back financials whenever you can? And
Love
then
that.
I let them interrupt my cleaning. I let them, honestly, if I'm under such a time constraint, I'm going to keep cleaning as they're talking to the patient about the finances. But hygienist to hygienist, for every hygienist out there listening to me, the other thing I have already done to support all the providers in my office. Number one, I support doctor because I explain to the patient what GER is, just like you do. Number
Yep.
two, I support the front desk by telling the patient, hey, your insurance might not cover it. This is how much it is. I have my lingo and my language that will help break down financial barriers.
Mhm.
And then, equal to that, I expect my team to support me that if I'm going to be adding this level of production into our, daily bucket of money, if you guys could help me out, get the next room set up, maybe get the patient back, somebody get me my x-rays real quick. So when everybody works together in a team,
Yes.
that's when this workflow is going to not only go really well, but you're going to be able to bring in GER without costing yourself stress, time, or money.
Yeah. I agree. And a better patient experience. It means more referrals. I mean, think about the ripple effect of this. That's
Oh,
and
yeah, referrals. My patients tell me all the time, well, I'm going to tell everybody I know to come here because I
Mhm.
don't think their dentist is doing this. Like you're telling me I don't need a filling, I can avoid a filling. I don't think the other dentists my friends see do that. I'm going to send them here.
Yeah, it's I know it's the gift that keeps on giving, but at,
Yeah.
in the whole of it, you no pun intended, in the whole WHOLE, you are you're truly being preventive, right? You're being preventive. You're using what the body already has to help heal the body while being non-invasive. The patients are open to it. I think it absolutely adds production to the practice. But if you keep the patient at the center of the care, no matter what it is you're using, that is always going to benefit the practice. And I love, Lisa, how you talked about the teamwork, the culture that surrounds you, because that's again a whole other topic, because a lot of people don't have that. So it's up
Mm-hmm.
to us to each individual, to you, to be accountable, to learn about new technology. You're here, so you're learning about this, but take this back to your practice There is a link that's in the show notes if you're watching this on YouTube, or if you're watching it on Instagram, like little shorts. It'll take you over to YouTube in the show notes, where you can click on that link, where you can contact vVardis and learn more about it, request more information. You can order this through your different providers, your distributors.
Yep.
But get started. There's so much training on this, and there's not a big learning curve. So, Lisa, thank you for joining us. I could talk to you for 3 more hours. How do you feel like that this changes caries management and patient-centered care for you?
Well, like I said, I mean, the reason I wanted to join this company is because I now have the opportunity where I'm not just changing one mouth at a time. I'm not just training the next generation dental hygienist and having an influence on every patient they treat. I truly am a part of something that is going to change the world. I tell the CEOs of this company all the time. I don't think they totally agree with me, but I tell them, I'm like, we're going to change the world. We are going to be able, for the first time in ever in this generation, to actually be able to decrease the most prevalent preventable disease on the planet, which is
Amen.
dental caries. We
Yeah.
have the first time to actually have a medicament that can put a dent in that. We've been fighting a battle as preventive health specialists, as dental hygienists. We've been going to battle against dental caries, and it's kicking our butts. We are not changing the prevalence rates. We haven't changed them since 1990. They've done nothing but go up, no matter
Right.
how much varnish we're doing, no matter how much medicaments we're doing, no matter how much patient education we're giving, electric toothbrushes, water, whatever's out there, it's not working. It's like taking a butter knife to a battle. Now, for the first time, you have a machete to take to the battle. You have a medicament that can actually come in that's going to make a difference.
I
And it
agree.
was an absolute no-brainer to me to say, not only do I want this on my kid, but I want this on every single patient that sits in my chair. I leave no lesion behind. I never ignore it. I never not say, well, I don't think this patient has the money, or maybe this patient's just too difficult to talk
Yeah.
to. So I'm just going to avoid this because I want to go to lunch early. I never let that happen, because I visualize every patient in that chair as my kid, Braden. And to bring in something like what you were saying, Kelly, this is a biomimetic medicament that is truly going in and repairing a tooth structure that has no ability to repair itself.
Yep.
Enamel cannot repair itself. This medicament can. We're not building some synthetic fake structure. We're literally rebuilding
Yes.
what Mother Nature took away and
Yes.
what was damaged.
Yep. No more watches, my friends. No more watches.
It's Curadon. No
It's Curadon.
W's, make them a C.
No,
It's a Curadon.
we want wins, but no watches. Well, thank you for joining us, Lisa. And thank you to vVardis for sponsoring this episode and supporting innovation that truly does change lives. And for all of my listeners, I always ask if you wouldn't mind going over to Apple Podcasts to give the Dental Handoff a 5-star rating. And I would appreciate it. And then if you're watching this on YouTube, go ahead and like this episode and subscribe so you're notified when new episodes drop. We'll see you next time, my friends. Thank you for everything that you are doing to change people's lives. Thank you, Lisa.
Thank you, everyone. Go out there and save a lesion today.
Thank you. Bye-bye.